welcome back. Thank you because you are not gone for too long and you stayed with us. Are you in need of new pipes? Or do you have a building and you need a specific type of pipe? Do you need new septic? And again. Pelazi Hardware, they are just here for you. So, usisikie ukiwa na shida ama shaka. They are located along Kubukubu Road, just next to Blue Line. So, as we proceed, there is a question I had asked previously. About the sexual desire of a man. Inaweza ama achukie totally kuwekwa na mwanamke.
Yeah, sure. Over the last 6 years, I have been into this field of counseling, especially family counseling. I've had on many cases and so many sessions of counseling women who perhaps have come to me like saying like I have spent like 6 months even without with my spouse. I haven't say even 1 year or so. So it is true that when a man is experiencing paternal postpartum depression, one of the effect of this is to take away the sexual desires. Because remember, sex is always in the mind. There's a mindset. And when the mind is sick, when there is this like a poor perception about sex because of the struggles that surrounds them, whenever they're experiencing this paternal postpartum depression, then it deprives them of the desires of the sex and the soul. So utapata like the energy. So basically it influences the sexual energies of a man. Yeah.
Also, I have seen some men or some women who persist to take a woman to give birth, your process of childbirth.
Yeah.
And after they come out of that place, hawatakangi mama na watoto. What goes on? What would you say about it?
Yeah, you see, like what happens is like when you take a woman into that childbirth or maybe to the labor or such, you see the much strains they're experiencing during the childbirth. And again, then maybe if it happens, maybe your woman has gone through CS or even the whole process that is characterized with a lot of emotions, with a lot of psychological tortures and all that, especially for a man who is kind of a feeling type of personality. There is a personality called feeling type, which is characterized by a person who is emotional. Yeah. Kuna watu in life wanakuwa so emotional by the things that happens, by the issues of life and such. Especially for men who have emotional or feeling type of a personality, they may be so much moved or easily moved by what they see, how they see their woman struggle, how they see their woman like cry in pain and all that, and this would traumatize them. So majorly when you see such men who would like say no to another child, no to their wife having another child, is because maybe they have gone through trauma that they saw in the labor ward and they never like shared it with anyone for them to express it. So it is like haunting them and it is in their mind, which is not expressed. So because of this unresolved trauma, then it influences them like not to maybe even dream of having another child because of the trauma they are experiencing. It is called trauma resulting from the labor of a loved one, or maybe spousal trauma. Yeah.
Could also this result to a father literally hating their own child at their bringing?
Yeah, most likely it would also influence that, as I said earlier about the relationship strain, where basically utapata like the father may not have that intimacy or feeling of having bond with their child. Because like when we are counseling men who are going through such, one of the things we empower them to do is to try create a bond with their child, so that there is like a strain may be over. So if a father who is going through postpartum depression, for men, mainly they would still hate their child because there is no bond. And because they have a lot of bad feelings, bad emotions, unresolved psychological issues towards their child and towards their mother. And if this one is not addressed, they will hate this child so much because there will be no like bond between them. So this lack of bond just takes all love away. So while we do counsel them, we empower them to try create that bond between them and their child, so as to take these feelings away from them. Yeah.
You've talked about counseling.
Yeah.
Is this the permanent solution ama itakuwa tu temporary?
Counseling helps a man to fully deal with the paternal postpartum depression. So whenever anyone goes to therapies, it is through counseling that will help them heal. Because sometimes paternal postpartum depression may be resulting from either a father feeling inadequate. You see, like they feel like, I'm not inadequate to be a father. I'm not inadequate to be a husband of somebody. I think I was not prepared to be this and this. So when people go for counseling, or when people come to us for counseling, there is a theory we call CBT, cognitive behavioral therapy. What cognitive behavioral therapy do is we distort their irrational beliefs. So that if a man says like, I'm not good enough to be a father, or maybe like they say like, I'm inadequate to be a good father or a good spouse, then we help them to dispute those irrational beliefs or those irrational thoughts. And once they dispute those irrational thoughts, they become very good fathers, then they become very good spouses, because the irrational thoughts have been disputed. So when counseling is done, they're able to deal with all issues so well, and they're able to become very okay, and the depression goes completely. Yeah.
Well, that is good to hear, but most men don't accept that they are undergoing something. Ama they are depressed. Wanataka tu wakwe.
Yeah.
I am a man, I can do this. If I show my weakness, nitaka mimi si mtu wa familia or anything. How can you tell them to face that?
Yeah. That is one of the challenges men have, especially because of the cultural and societal expectations that requires men to be strong, that requires men not to be emotional, that requires men like to be man enough so that they're able to handle their issues themselves. If a man must be able to overcome all these psychological challenges of postpartum depression for them, is that they have to acquire open communication, because that is the first thing we empower them to do. Because so that whenever they are experiencing all these pains, all these emotions, all these psychological tortures, are they able to openly share that, by the way, I'm feeling like I have no love for my wife. I think I'm feeling like I have no love for my child. I think I'm feeling like to just sleep on my own bed, my own room and all that. So one of the things we empower them to do is we empower them to have clear and open communication. So they're able to communicate this to their spouse. They're able to communicate this to friends who can help them. They're able to communicate this to either the therapists or people who can be of help to them. So experiencing such things as those, one of the best, as you saying it, is that they have to be so clear to themselves. They have to be so real to themselves. They have to be so honest to themselves. By honest is that if I am feeling bad about everything, I'm able to say I'm feeling bad and share my issues. So one way of helping those people who are in this thing of postpartum depression is, number one, is open communication. So as they are experiencing it, let them share. We say that sharing is therapeutic in counseling. Say that sharing is the first step of healing. Because if you have not shared, you cannot heal from something which you don't share. So open is so critical. Then we also speak of them now seeking therapy to professionals who have competence in the areas of paternal postpartum depression, because sometimes people may share, but they may share to wrong person who have no information, or maybe who have information, but which is information. So we empower them. Even they have to share to people who have information about like family counseling, about like depression, about like postpartum depression for men, because people may have information, not all have information of helping. So they have also to share with people who have this expertise, so as they're able to get that help. Again, we also empower them to seek support from other people who have gone the same thing, who have experienced the same thing. We call that peer group support. Yeah, kuna so many fathers out there who have gone through the same issues. They can form a group counseling or a group support system, so that if there are those people who are experiencing this thing, they can be sharing. By the way, how are you doing today? By the way, nimekuwa nikifeel hivi na hivi na hivi, but nilifanya hivi na hivi na hivi nika overcome this thing. Wengine anasema by the way, pia mimi nilikuwa nasikia like kuishi kwa kitanda yangu peke yangu for like 6 months, but nilifanya hivi na hivi na hivi nika overcome this. You see, so peer support system is critical. Open communication is critical. Seeking therapy to counselors is okay, but the last one also we can speak of is also seeking family support.
Oh.
So familia pia ni muhimu sana wakati kama huo, so that they may not judge them. They may not like misjudge their feelings, their thoughts, processes. They offer them a shoulder to lean on. Yeah.
And what can you tell to the new moms venye watasaidia their new dads?
Yeah, to the new moms, yeah, paternal postpartum depression is real. So it is okay for new moms to understand the signs, because if they don't understand the signs, and if they don't understand that there is paternal postpartum depression, they may not help. So the thing is, one is they understand there is this depression, and also number two, then they understand their spouses, and they see how they can support them, and they see where they can offer a shoulder to lean on, and also become a pillar on their life, so that if in case they can support them somewhere, whether financially, whether economically, whether socially, whether emotionally, they offer that support to them, so as they're able to overcome all this. Yeah.
So if a parent out there, a new parent out there, wants to seek you or seek counseling, how can they get to you?
Well, if anyone may need our services or counseling services, they can reach out to me either through my number, which is 0718 23 24 93. 0718 23 24 93. Through that, they can be able to assess me.
And where are you located?
Well, we are located in Embu, in a building called Subira House, first floor. Kenya Institute of Professional Counseling. Even wakiweza enda kwa website like Facebook, wanaweza tupata pale. So in Embu, Subira House, first floor, opposite Nokras Hotel. Yeah, that is where we are.
So that is where they can find you.
Yes.
So as a new dad, usisikia aibu, maybe you're going through something, ama you're traumatized. This is the place you need to seek medication. Medication si lazima ikuwe hospitali or anything. Your mental state is very important for you and for your family as well. So thank you very much for keeping up. This is the Health Hub Show. I am Nyambura Kamau. Tupatane Pelezi. As you get your new pipes, you get your showers, and as you get your sink.